We're very excited to be able to bring digital mammography, our state-of-the-art equipment, to patients in Sussex County. It's a newly renovated section exclusively for the Women's Health Center.
Right down to the artwork on the walls. It's very spa-like, very comfortable, carpeting on the floor, very welcoming, all brand new, all completely renovated.
It's very serene, it's comfortable, it just makes you feel like you're not, I think it's more like a spa atmosphere than a mammography or a doctor's office.
We have digital mammography, and we have bone density. We have breast ultrasound, and we are currently looking into getting stereotactic biopsy. So if they do find something on your mammogram, it's a much less invasive way of getting a small core sample to see what's going on rather than having open surgery.
We have a full field digital mammography unit. It's made by GE, the Essential. It can accommodate all types of breast sizes for women.
Digital versus analog film brings new and improved benefits to the technology helping fight breast cancer.
Analog is actually film. It's the way we used to do things. We've been doing analog since the 80s, 1980s. With digital, the image is much more profound, much more detailed. It allows the radiologist to see things that they would normally not be able to be seen on an analog film. With the digital images, it makes it easier for the radiologist to look at them. Our radiologists, we have our breast radiologists that specialize in that type of imaging. And we are able to bring to the patients from diagnosis to treatment at St. Clare, so they would actually have their screening or diagnostic mammogram here at St. Clare's health system, and then they would go, from there if they were diagnosed. We feel that, if the patient is diagnosed, then they would be able to follow up with St. Clare's cancer care. We have nurse navigators that specialize in cancer care that walk the patient through the diagnosis and treatment. So even if you were not diagnosed with breast cancer and you had something going on where you had to have a biopsy, our nurse navigators are with you through that journey. So it's not like you're just coming in for mammography. You're actually, we have the support behind us.
We have everything here in one corridor that you need. We have one number that you call to get it all scheduled. We do have a low dose machine, so if you're worried about radiation, that's not an issue. This is one of the lowest doses out there. It is direct digital, like Mary Beth was saying, so you don't have an old-fashioned image that's sort of being morphed into new image that doesn't have the quality that the direct digital has. That's really important. And it is one of the newer, if not the newest, bone density scanning machines, so that's very low dose also. And both tests are very quick, maybe 20 minutes in and out.
Early detection is key, and this center provides the technology for mammography, bone density, and breast ultrasound.
Early detection is the key. The faster you find it and get it taken care of, the better your survival rate. And with bone density, women are falling and breaking their hips and wrists and ribs, and you would like to know what kind of risk factors you have. So we are doing those. The guidelines say every 2 years, unless you are on a drug that is helping you form new bone, and then you can have one every year to see if that bone is being laid down. So you're assessing your risk factor. I mean, I would like to know before I fall whether I have a chance of breaking my hip so I can do something proactively to prevent that, either with nutrition or exercise or vitamins or some osteoporosis drug that they have. So that's really important, and for men too.